Gout, it's very common actually, but there are lots and lots of misconceptions related to gout, because I see day in and day out every patient who has joint pains or any kind of pains in the body, their uric acid levels are always checked. It's not that common as well that you need to get uric acid checked for any person. So basically, gout is an inflammatory disease in which purine metabolism, there's a disbalance in purine metabolism. Either there is formation of excessive uric acid, or uric acid doesn't get metabolized, so it doesn't come out of the body, and uric acid gets deposited in various joints. So uric acid doesn't come as a metabolism of protein. It always happens in the cycle of metabolism of purines. Purines is a kind of a diet supplement, you can say, or there are few diet, there are few food items in which there's a lot of purine. So if our intake of purine is a lot, then formation of uric acid is excessive. So yes, if this uric acid gets deposited in the joints, so crystals of uric acid deposition causes damage of these joints. And that condition of inflamed condition of the joints is called gout. The most common joint involved for gout, and that's the diagnostic feature of the gout itself, is the first toe, the big toe of the feet, the lateral, the medial aspect of that area gets involved. It's the first, basically among doctors' term, we can say it's the first MTP joint of any of the foot. If it gets very hot, red, tender, it's very, very painful. Mostly it happens when you get up in the morning, your joint will be so inflamed and tender, and it will be so painful that you won't be able to keep your foot on the ground. Walking with that foot will be really tough, and even a slight touch on that inflamed joint will be very painful. So this can happen as a first episode of acute gout, and sometimes it just just with a little bit of painkiller, it gets cured and it never happens again. It's like first and the last time. It happens most of the time like that. But in some cases, it does recur. If you have a bad lifestyle, or if you have any comorbidities or things like diabetes or psoriasis or things like that. So yes, then it tends to recur. It can happen again and again. And eventually over the time, it can destroy that joint, and it can involve other joints as well. Gout is very common in males, very, very rare in females. But yes, in postmenopausal women, it's still common. Not very common as males, but definitely it's more common in males. Then people who have any kind of kidney diseases, because uric acid is not able to get excreted through the way of urine. So the amount of uric acid is high in blood. If you have any kind of kidney diseases, if you are on some kind of drugs, like some kind of diuretics or antihypertensives, there are few medications. If you are taking those medications, then yes, tendency of increase in uric acid is much more. Or some kind of anti-tubercular medicines are also there, which tends to increase the uric acid levels. Then if your diet is like that, if you're taking diet which is rich in purine, like if you're taking a lot of rich non-veg, rich in meat, and high amount of alcohol, or if you're taking a lot of sucrose containing, artificial sweetener containing juices and cold drinks and soda drinks, things like that, if you're smoking a lot, if your weight is a lot, if your body mass index is too high for your age, and if you have things like psoriasis or diabetes, things like that, then yes, you tend to have high uric acid. And if it is not getting metabolized very well in the body, then it tends to aggressively get accumulated in the joints in the form of crystals and tend to destroy those joints. So these people are more at risk of developing gout. Diagnosis of gout is actually, I should say that 95% is through the clinical examination. If you go to a doctor or rheumatologist, then just by looking at the joints and taking a good history, we can easily diagnose that you have gout. Then uric acid levels, it helps sometimes, because There are a lot of times when uric acid level can be normal in spite of you having gout. So it doesn't help always, but yes, we do get it done because it helps in treatment protocol also, because there has to be a target of uric acid which should be maintained. And then we generally always aspirate the joint and look at the crystal under the microscope, and that's exactly the diagnostic measure. And then there are a lot of some CT scan options and ultrasound options are there which help in diagnosis of gout. And yes, this is how we diagnose gout when a patient comes, when we are suspecting gout in them. And then once you suspect, there are a lot of good options. Initially, we do give some kind of NSAIDs, then a little bit of steroid if required, if disease is very aggressive. And yes, sometimes we do need to give a very mild dose. Then there are a lot of uric acid lowering drugs which are very helpful. If the joint is very, very much damaged, then sometimes we need to inject that joint. Intra-articular injections also need to be given. There are some injectable medicines which help in correction of gout. So yes, there are a lot of medical options which are very helpful in gout, treatment of gout. People who are diagnosed with gout, they should have some kind of lifestyle modification, which is very important. So the first and important thing I would like to mention is you don't need to stop proteins at all. And if vegetarians stop eating proteins, then there's hardly left to eat. No? So you can have all kinds of cereals, pulses, rice, milk products, curd, paneer, everything. All kind of vegetable proteins you can easily have. But you should avoid high fatty meals. Like if you're taking milk or milk products, then it should be low in fat. It should be from a double toned, when you take out all the fat. So it should be from that kind of milk. And you should definitely avoid non-vegetarian food. You can have fish to some extent, but yes, other meat products you should avoid. You should definitely say no to alcohol and smoking. Keep a check on your weight. Do regular exercises. If you have any kind of comorbidities like diabetes, blood pressure, heart diseases, or kidney diseases, then always be very careful, take regular medicines, and visit your physicians regularly regarding those diseases. And if you are diagnosed as gout, then please be very regular with the rheumatologist. You should not stop medicines immediately or abruptly in between, because if it becomes chronic or if it becomes very recurrent, that the attacks of gout are very recurrent, then it tends to destroy those joints, and your joint will not be normal as it used to be, it should be. So just a regular visit to a rheumatologist and keep a check on your good lifestyle. That's good enough for maintaining a healthy life. Gout can be easily prevented because if someone is taking good diet, no junk foods, well balanced diet, eating all kind of good things, doing regular exercises, taking care of their health, and saying no to smoking or alcohol, and keeping a check. If you suppose you had first attack of uric acid and then you are very vigilant about your lifestyle and you take proper medication, then yes, the second attack of gout can be easily prevented.